Hello, I'm Jamie Lee Salgatar, and welcome to This Week in MedIT, your source for medical technology news, brought to you by C&G Technologies. Here's what's happening this week. The feds are cracking down on medical care and Medicaid billing errors through the use of information technology. The administration has cut wasteful, improper payments by $17.6 billion in 2011. The cuts included those paid for Medicare, Medicaid, Pell Grants, and food stamps. The Office of Management and Budget Director Jack Liu said the cuts are due to the effective and aggressive use of technology. The Department of Health and Human Services is launching 4 additional pilots to further decrease billing errors. These processes include expanding the use of recovery audit contractors, testing changes to outdated hospital billing systems to help prevent overbilling, changing the processes for approving payments for medical equipment with high error rates, and working with states to improve fraud detection. Next up, most physicians are aware of the benefits of implementing new technology. If done properly, it can streamline workflows and save money. However, what is the true cost of health IT? Lisa Suen, managing member of Fazilos Group and author of the blog Venture Valkyrie, shares some key points to understanding the cost of health IT. The most cost-effective IT is enterprise-directed. May not always be the most efficient or helpful to your practice. Trainings are essential. Make sure everyone in the company is aware of the processes and usage of the newest technology. There's a disconnect between effective IT and new IT. Suen stated that this disconnect between medtech buyer and seller is the most problematic issue facing the industry. Lastly, lack of security is costly. In her blog, Suen wrote a quote, "According to the study, most provider institutions aren't even making patient privacy and data security a priority." CMS Institute is noted to be lenient for the HIPAA 5010 conversion. The compliant date is set for January 1st, 2012. However, there will not be an initial enforcement action. An important point of clarification is that health organizations are not getting a free ride and should not simply postpone HIPAA 5010 conversion. That's it for this edition of This Week in MedIT for the week of December 7, 2011. If you want to be featured on This Week in MedIT, email us at news@thisweekinmedit.tv. I am Jamie Lee Salgatar, and have a great week.